to Texas schools.
Houston U.S. Representative Sheila Jackson Lee came together with doctors and nurses demanding all U.S. hospitals provide adequate protective clothing for healthcare workers who may encounter Ebola.
This is the kind of equipment that should be utilized by any medical professionals, including nurses and others that are dealing with the bodily fluids, to ensure that they have the ability to be protected.
The Congresswoman said she supported the call for President Obama to use his executive authority to set uniform Ebola procedures nationwide. National Nurses United called for better training and equipment. Melinda Markowitz is the union group's vice president.
Even today, in the hospitals, nurses have not been trained on how to use this equipment, and even in some hospitals do not have this equipment.
Her organization blames sloppy procedures at the Dallas hospital that treated the first Ebola patient, Thomas Eric Duncan, who infected 2 nurses who treated him. Markowitz says National Nurses United has been asking for better preparation since the Ebola outbreak began in West Africa in March.
We have been going to the hospitals and saying, this is happening in Africa. What are you doing to prepare the healthcare providers and the nurses if this should come to the United States?
And what was the reaction at that time?
Well, we're prepared. We're prepared for any infection. And we know that's not true.
A recent National Nurses United survey showed that 85% of U.S. hospitals have inadequate Ebola training, and many lack proper equipment and waste disposal systems. Nurse Gwendolyn Abatekwe, who works at a hospital in Austin, Texas, says it's unacceptable that the nurses in Dallas became infected while doing their job.
I'm grievously saddened by these 2 nurses contracting the Ebola virus, and I know that they were doing the best that they could do to work with their patients.
Nurse Kelly Miller stressed the need for teamwork when using protective suits that become unbearably hot to wear for more than half an hour. She says at least 2 people are also needed to avoid dangerous mistakes.
The reason you work in teams is to make sure that the other person doesn't, helps you with the protocol to see if you've missed something.
The other matter that healthcare professionals say needs to be addressed is public education about Ebola, which Congresswoman Jackson Lee says could prevent unnecessary panic and help save lives. Greg Flakus, VOA News, Houston.
We're going to talk about the letter that the nurses are going to send to the White House, and I'm going to stand by that letter.